Hi, welcome to Health Authority TV. My name is Devin DeVries. I'm the editor-in-chief of Health Authority Books. And our mission here at Health Authority TV is to bring together a community of health business experts and find out what's currently happening in their area of health and look to the possibilities of the future. This week, we're joined by Frank King, the co-author of the series Guts, Grit, and the Grind, a mental mechanics manual. Welcome, Frank.
Thanks, Devin.
Yeah, it's so nice to have you with us today.
Delighted.
Let's start with, who do you serve as a health authority?
I serve the top 10 at-risk occupations for suicide in the United States.
That is a really, really critical thing to
Yes.
do.
Number one being construction. 1,000 people die by accident on average every year in construction by accident. 6,000 die by suicide. You're 6 times more likely to jump off the building than fall off, which is ridiculously high
Wow.
suicide. Yeah.
What's number two and number three?
Agriculture is number two. Farmers subject to commodity prices, the weather, financing, tariffs, embargoes, and it's somewhat of a solopreneur business oftentimes, family business, farms within the family for 3 generations, and you're about to lose it.
Yeah,
And then dentists, I think, is the number one white collar at-risk occupation.
interesting. Well, that is a noble work for sure. What services do you provide in this area?
Suicide prevention as a workplace health and safety priority. Many industries, although it's changing, put more emphasis on physical health than on mental health. Oddly, because depression costs businesses more hard costs, medical costs, lost time than the top three physical ailments: high blood pressure, stroke, diabetes, I guess four, heart attack. Depression costs more than those four put together to U.S. businesses. And I
Wow.
speak I speak on I speak on as a suicide prevention. What I do is I go in and are you familiar with Donald Miller, Build a Story brand?
Yes.
I talk about suicide prevention and I teach people how to recognize the signs of depression and thoughts of suicide, what to do and not to do, what to say and not to say, and how to find resources. And I tell the audience, I'm not here to save someone from suicide. I'm here to empower you to save someone. And that's Donald Miller's thing, is make the audience the hero in the piece. So I'm not up there saving lives. I'm up there teaching them how to stop a suicide.
Yeah, I can see how that would be a very powerful distinction for them at the company level. Well, that's really, really great. Based on your experiences then, and this is a question we're trying to get thoughts from a lot of health authorities, is
Hmm?
how do we think we could redesign America's healthcare system to better it?
Well, one thing is if I go to my therapist and I say I'm having thoughts of suicide, he or she is legally bound in most states to hold me in front of a judge. And the judge decides whether I'm going to get a 72-hour, all expenses paid visit to a gated mental health facility with no shoestrings or belt. So if we could change the law such that you can talk about thoughts of suicide without worrying about being locked down for 3 days, which stops a lot of people from mentioning it out loud. And that leads me to, if we could start the conversation on suicide. What I discovered rolling up to my first TEDx talk was, even though one person dies by suicide in the US every 9 minutes, around the world every 40 seconds, hardly anybody talks about it unless you bring it up. And then almost everyone has a story. So if we could focus on starting the conversation, we should make talking about depression, thoughts of suicide as easy as talking about sports or the weather. So people don't feel threatened. They don't feel like they're going to be locked down. Also, I think we should have a psychiatric bed on demand. If you are having a psychotic breakdown, I believe you should be able to just go, I need an inpatient bed. I need it now. I remember a story from Pennsylvania where a soldier had come back from a war zone with PTSD, and he tried drugs. He tried, was
Mhm.
prescribed drugs. Had a therapist, and it just wasn't working. And he said, "Look, I really need an inpatient arrangement. I need a bed." And they said, "Well, we have a 12-week waiting list."
12 weeks.
Yeah.
Wow.
So what are the odds he makes it 12?
Yeah.
So I think we should have on-demand, mental health. Also, a friend of mine in the county in which San Antonio, Texas resides, he took over the mental health care system, and they were in the red, and they were and San Antonio was about to build another jail. The current jail was busting at the seams, and one of the reasons was that police, first responders, are often the first line of defense with people who have mental illness. They pick them up because they are, causing a ruckus. And so he had all of his officers, all the officers in the county, sheriffs and police, trained in CIT, crisis intervention training. And what they teach them to do is distinguish between a crime and a mental health crisis. And so if it's a crime, they take them to jail. If it's a mental health crisis, they take them to whatever is the appropriate facility, whether it's drug and alcohol or a mental health facility, and they ended up not building the second jail because that's where everybody with a mental illness was ending up in the first jail. And they had extra beds in that jail to rent out to other counties because they were taking people with a mental health crisis to where they should be going and putting the criminals where they should be. So I think if we can separate those two and allow first responders to make that call, is it a mental health crisis or is it a crime? We can serve the public better from a mental health perspective.
Yeah, that's a great example of just shifting our mind, the mindset and the thinking of how they approach those people.
Yes, and sometime in the early 20th century, in the 1920s, psychiatry and psychology made a shift from trying to figure out exactly what was causing the mental illness, treating the soul, as it were, not in a religious sense, but in a religious sense, but treating the exhaustion, the soul exhaustion, to a medical model where the first thing to do would be to create a diagnosis and then prescribe. So a pharmaceutical model. And here's an example of a problem with that. Young people with ADD and ADHD, oftentimes young people who have suffered childhood trauma will present with symptoms of ADD and ADHD. It's easier to give them Ritalin than it is to dig deep and figure out, is that what's happening, or is it a result of childhood trauma? So it's and I understand, because for psychiatrists, psychologists, whatever, psychiatrists to be reimbursed, they have to make a diagnosis, which has a number attached to it, a code, and that code's how the insurance companies pay. So I understand the business model, but it's a shame we're not allowed, or they're not digging deeper to figure out what is really, as a friend of mine did a TEDx talk called Soul Exhaustion. Figure out what is actually going wrong, what went wrong, what's going wrong, why are they in need of these medications?
Yeah, absolutely. I think those are really great ideas and thoughts, and this is a really great way to start this conversation. And we really want this to be a conversation. So for our listeners, we would really love to hear your ideas and other concepts and how we can shift this narrative, especially around mental health. It's it has gotten better, but I still
Mhm.
think we definitely have a lot of room to go in that, like you said, making it something that is safe and normal to talk about in our society.
Yes, and the stigma remains. It's less than when I started. Sadly, when I did my first TEDx talk, 39,000 people in the US died of suicide that year. Last year, it was 49,000 and change. So it's not getting better. Unfortunately, it's getting worse. And, the pandemic didn't help.
Right.
And 8 out of 10 people who die by suicide these days are men. And so the four books I'm co-author of, it's I meant they were all done for men, because we found, when we did a little research, There were no books at Barnes and Noble or Amazon anywhere specifically on men's mental health. And each was an anthology. Each one has 12 stories. Men, because men tend to take advice from men. And in the first 500 words, life's good. Second 500 words, life goes to heck. Third 500 words, here's how I'm coping. With the idea that a man would pick it up, see his particular issue, see how another guy was handling it, and think, well, I could do that. So that's why and we thought we'd be lucky to get 12 guys, one book, 12 men to come clean about what was their drug and alcoholism, divorce, bankruptcy, whatever. We ended up with 60. It was going to be one book. It became 4 books because there's something called male reciprocity. If a man goes through something like that and comes out the other side, for some reason we are wired to help other men. And so we were delighted that that many men would step forward. So we were able to do 4 books instead of just the one.
Yeah, that's great. Well, thank you so much for sharing your thoughts. We will leave a link to Frank's website in the show notes, mentalhealthcomedian.com. And also, I would encourage you to check out his TEDx presentations. He has a record 13, is that correct? What we're up to
Correct.
now? 13 TEDx presentations. And they are a mixture of really important content, but also finding the humor in it. So we will
And
make sure those are all linked, so you can find that great information as well. So
and
thank you
can
for bringing it up.
leave you a thought
Yeah,
again on
absolutely.
healthcare in the U.S. I believe the right person with the right information at the right time can save a life.
Yeah, that's beautiful. Well, thank you so much. Thank you for our listeners. And until next time, may you be healthy, wealthy, and wise.